First topping the news here at 5:30. This week, the FDA updated its COVID-19 vaccine guidance, but the federal agency limited access to the vaccinations for certain age groups. The emergency use authorization, which made the shots widely available for healthy young children, was rescinded. That means healthy young children, it is not recommended. It is no longer recommended that they are 5 years old and younger to receive that COVID-19 vaccine, unless it's approved by a physician. The FDA's decision came after the American Academy of Pediatrics strongly recommended the vaccine for children 6 months to 2 years of age. HHS Secretary Robert F. Kennedy disagrees with those recommendations and is ignoring them. Meanwhile, the new vaccines come along with a new variant of COVID that comes, as Kels mentioned, with a painful sore throat.
All right, to discuss the impact of the FDA's decision and share more information, we are joined by Dr. Tom Russo, now distinguished professor and chief division of let's keep scrolling in the prompter there, the infectious diseases at the Chief of School of Medicine. I'm sorry, I cannot remember that whole title. I needed the prompter to stay up with me there. Okay, Dr. Russo, thank you for being here. This is a lot of information to digest, and it's a lot of politics to digest. So you're here as the medical expert telling us what's politics and what is science. So we appreciate that. So I would guess start with, is this new, guidance political in any sense?
Well, let's start with the process.
Okay.
I think that alleviates some of this confusion. So the FDA enables licensure of a product, in this case, a vaccine. And it'll be for certain groups, and we already heard what those groups are. And those are individuals that are 65 and older. If you're 6 months to 64 and have underlying disease, that puts you at risk for severe COVID. But healthy individuals were left out of the licensure. The second step, however, which has not formally happened yet, is the CDC then makes recommendations. And that group is meeting in September, perhaps, so we've heard a possible delay of that. They could either expand who is eligible, they could decrease who is eligible, or they could follow the guidance from the FDA. Now, the American Academy of Pediatrics is disagreed with the licensure recommendations. They've expanded their recommendations to all children 6 months to 24 months of age. And largely, this is due to the fact that of vaccine-eligible children, this group is at greatest risk for hospitalization and bad outcomes, and vaccination will decrease that likelihood. The risk-benefit ratio strongly favors vaccination in this age group.
It is a confusing thing. You laid it out, I think, brilliantly right there, as well as you could. And hopefully people understood at least some of that. But even just before, we were reading the guidance from the White House. We were reading stories from all across the country and trying to determine, well, are 5-year-olds even allowed to get vaccinated if they want to? And it took us a long time to figure out that, yes, while the FDA now no longer recommends that, if you, as a parent, have a discussion with your physician, your child's physician, you can absolutely get them vaccinated if you so choose.
Dave, that's absolutely true. So if you look at the CDC website, and it's not through the usual process, they tweak the recommendations. And there's a footnote that says that through the shared decision-making process, parents and their pediatricians or physicians, if they deem it appropriate to have a healthy child, which is not eligible through the FDA licensure, then that individual can be vaccinated. In fact, Health Secretary Kennedy mentioned 2 days ago, again through an informal process, that actually would apply for all healthy adults up to the age of 64. That remains to be seen. We're sort of anxiously awaiting what's going to happen with the CDC Advisory Committee, which subsequently, by the way, needs to be signed off with the head of the CDC, which is right now an interim director as well.
Yeah. So is the suggestion, go to your physician, ask them type thing?
I always recommend speak with your physician about all matters with health, particularly in areas of uncertainty. Be careful of social media, not the best source for health information. Physicians are an informed and trusted source, always the best way to go.
Great.
From the medical industry's perspective and from a longtime physician like yourself, just kind of taking a step back from either the politics or the recommendations or what have you, just the fact that you've got two leading agencies, the FDA and then the Academy or the American Academy of Pediatrics, disagreeing, that's got to make it more challenging as a physician because of the confusion for your patients.
It makes it extraordinarily challenging. Public health is not political, should not be political. Public health should be based on the data, and the recommendations should be based on what's best for the American public. And right now, there seems to be some disagreement from the FDA, the CDC, and authoritative bodies such as the American Academy of Pediatrics and others.
I want to get to this Nimbus variant. It's said to cause razor blade pain in the throat. Can you tell us a little bit about this variant, when it kind of first started to be seen here, and that pain that it's causing?
So Nimbus actually is a little bit of a passé variant. The new kid on the block has got the nickname Stratus. So we're sticking with cloud terminology.
Okay.
These are all Omicron derivatives. And I'd like to add that the vaccines that have been approved that are going to be rolling out soon should be very active against these Omicron variants. This razor blade throat is a symptom that makes the social media rounds, but it's been described with COVID really from the beginning.
Okay.
Some individuals have very mild symptoms. Some people have this terrible sore throat that is really disabling for a few days. And so I don't think it's particularly unique to these new variants, just individual variation.
Very good. Thank you, doctor, for explaining that.
And the timing of all of this, too, is coming at a very busy time for parents. We are getting back to school. What's your best recommendation as we're now getting into that respiratory virus season amid all this confusion with vaccines?
Go see your pediatrician. Make sure you're up to date on all the vaccines, that all for childhood illnesses. Vaccines is one of the greatest public health advancements that we've ever had. It's saved countless lives over the years. And I think your pediatrician is the best source of reliable information.
Dr. Russo, thank you for
Thank you,
joining
Dr.
us. We do appreciate it.